HSG test, what happens to your cervix? Imagine you're about to have a special X-ray that helps doctors see inside your uterus and fallopian tubes. During this test, called a hysterosalpingogram, your cervix plays a key role. The doctor will gently insert a speculum into your vagina, just like during a pap smear, to see and access your cervix. They will clean the area carefully to reduce any risk of infection. Then, a thin, flexible tube or a small metal tube is carefully inserted through your cervix into your uterine cavity. Sometimes, a tiny clamp called a tenaculum is used to hold the cervix steady during this process. This step involves some gentle manipulation of the cervix but is usually well tolerated. Once the tube is in place, the doctor slowly injects a special contrast dye that contains iodine into your uterus and fallopian tubes. The cervix acts as the gateway, allowing the dye to flow inside. As the dye fills your uterus and tubes, X-ray images are taken to see if everything is open and normal. After the images are captured, the tube and speculum are removed, and your cervix returns to its usual state. From a fertility point of view, the cervix itself is not usually affected long-term by this procedure. The process is designed to be safe and minimize any trauma or risk of infection. Some women might feel mild cramping or discomfort during the procedure, especially when the dye is injected or the cervix is manipulated. It's important to remember that the HSG test helps identify issues with the shape of the uterus or blockages in the tubes that could be affecting fertility. It does not diagnose endometriosis because it does not visualize ovarian or tissue lesions outside the uterus. Overall, during an HSG, the cervix is carefully accessed and temporarily manipulated to allow the dye to flow through for imaging. It is a safe, minimally invasive procedure that provides valuable information about your reproductive health. If you are considering this test, talk to your healthcare provider to understand what to expect and how it fits into your fertility assessment.